Uh, Hi, Daniel.
Hello, everybody.
Hello.
Can you talk us through the dashboard which you created for Ministry of Health in Uruguay, please?
Yep, sure. I'll try to share my screen. Please let me know if this is working. Just 1 second. Nope. Let's try again. There.
Yes.
Can you see it?
Yeah.
Okay, great. Well, let me do a very brief introduction. This is the product of an agreement we made with the Ministry of Health in Uruguay. We are a civil society organization. Our name is Data Uruguay, which is very confusing usually when you work with data to be called data, but it's the name we've got. And what we did was to use some information they were already publishing and both helping them get it in a more usable way, like with a better interface and stuff like that, and also helping them publish this data as open data properly, because what they had before was basically Excel sheets, which were thought to be as useful as possible, but weren't really very friendly, neither very machine readable or anything. So this is the result. And basically what we are doing here is, first of all, showing a very general view of the data we have on these health providers. This, I should say, is every single health provider in Uruguay, both public and private. So we have information from the whole system, which is also pretty interesting. The categories we have are general structure information, waiting times, user rights, prices of tickets and orders. This is like goals that the ministry sets to the providers, amount of affiliates, and human resources. Right here in this dashboard, what you can see are grouped numbers. I mean, this is not like the granular data. We will see that later. In this part, we are trying to group some of this stuff so we can show it to give like a general sense of the quality of service in the different providers. So let's hide the references. Here you got the different providers on the left side, and here you already got some information like how many primary it's not offices, it's like clinics they have, and how many secondary and emergency doors they have. Then on waiting times, you've got different kind of waiting times, which you can group, and you can see in this small infographic. So as you can see here, you got a general sense that on this one, you have very short waiting times, especially if you compare it with someone like this. On user rights, you have also different user rights and the satisfaction that affiliates of that health service have declared on that specific issue. You can also obviously compare. And we got the same kind of infographic here for the prices of tickets and orders. These are also grouped, like medication as a whole group, consultation, urgent consultation, and lab studies. Then you get something that comes from an annual survey that the health ministry does, which has to do with, sorry, not survey, with goals that the ministry has for each and every one of the health providers and how much they have accomplished towards those goals. This is the goals right now have to do with children under 1 year correctly controlled, pregnant women correctly controlled, and how many of the users have their own reference doctor to the one they should consult to. Then we have a very simple graph that has to do with the amount of affiliates each of the health providers have. And finally, the human resources they have every 10,000 patients, which has to do with general doctors, pediatricians, gynecologists, nurses, and like lead nurses, something like that. So in this case, what you get is a very, very general sense. You can choose the place where you live. These are the provinces in Uruguay. I live in Montevideo. So this will already filter the results only for the ones in Montevideo. Then I can choose some institution. I'll choose the one I have. And there you have it selected on the first row, so you can compare it. But you get to the fun part when you go to the full data and comparison. You can do this through this button or over here. What you can see now is not a grouping of that information, but the most granular version we have of it. So for instance, here you have the tickets. Well, this, once again, this is not the best choice because they haven't shared their data, but let's choose somebody else. And already I can tell you that you can, as you can see, you can also compare different providers, up to 3 actually. And here you can see prices not grouped as we had them in the screen before, but every single price point we could get out of them, right? So instead of medicine in general, you have the general medicine ticket. When you are part of the system where your health service is discounted from your salary, or if you're paying it on your own, you have the price of special medication like I don't know how to translate this. Well, now special medication. You have different consults under different prices, gynecologic consults, specialists, etc. You got dental consults. You got different studies like echography, that's another thing, like echo Doppler and X-ray and MRIs, stuff like that, and lab routines. And you've got the price of each one of them. On these 3 examples, you can see that sometimes you get the price. Sometimes this means no cost because this is the public hospital, the public health service, so you don't have to pay for this stuff. And sometimes they don't send the data, and we are very, very on purpose. We're trying to show that they haven't sent the data in order to shame them, if you wish. So beyond prices, which was just an example, so you can see the granularity. You have, again, the general structure information, the goals, which you also have if they have accomplished or not. You have information on the waiting times on a much more detailed way with the amount of days you have to wait. You have information on user satisfaction, which this is from a survey they run every year. And there you have every single thing they ask. On human resources, you have also a lot more information, like, for instance, internal medicine and what is this? Neonatologists, stuff like that. As you can see also here, there's some missing information, but that's part of what we want to show and pressure them into sending to the ministry. And we also have some structural information that has to do with some like services. For instance, if you can reserve your consult by phone on the web, if they send you an SMS or an email or whatever to remind you of your consults. And the other thing we have is very ugly, to be honest. We haven't had enough time to work on this properly. But for each of the clinics they've got everywhere in the country, you've got information on every service they have or they don't have. So for instance, in this clinic, you can see they do have like allergist, anesthesiologist, heart surgeon, blah, 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 and they don't have a physiatrist or whatever. So this information, as I was saying, this is something that we had to do in a rush, so it's not shown in the best way possible, but it was very important information because something that the ministry cared about and cared a lot about was people choosing services that were not only complete, but also close to people. Because you might go and affiliate to a service that has everything you need, but they don't have it close to you. So if, I don't know, if you're doing chemotherapy or whatever, you have to go all the way to the capital or something like that to get your chemotherapy, and that's obviously not very practical. And well, that's like the fastest version I can do of the walkthrough of the app. What I could tell you maybe is that we did this because every February in Uruguay, people are able to change health providers. You can't change whenever you want. You can do it only once a year. This has a very long explanation, so maybe it's not the best time to do it. But the thing is, the ministry was very keen on people doing the best possible choice based on information and not only on marketing. Because obviously, since you can only change once a year, that's the time when every single health provider is doing all their advertising and stuff like that. And to be honest, people don't have much to go about beyond what they see on TV or read on the paper. So this, for the first time, was a way to get like very deep and trustworthy information on their health providers. I don't know if you want to go to questions or if you want to see something else.
How often is the data updated, maybe?
Well, right now it's updated once a year, but the plan, although we are already late on that, is to update it at least twice a year. We should be doing it right now, and we haven't yet. So, I mean, we and the ministry. But this has had to do also with there was a change in government. We had elections late last year, and the actual change takes place in March. So everything's a little bit late, but the plan is still to update that information before the end of the year, and then once again in February.
How do you validate it? Just to double check that. Is there some process to say that that figure that they gave us is right?
Sorry, can you speak a little bit louder?
How do they validate it? You know, is there a process that says that I'm able to get back onto you and say, I did this procedure with this corporation or with this health provider, and they charged me twice that figure that's up there?
Yes. Well, not yet, but it's part of the plan. What we agreed with the ministry was to have 3 stages. This was the first stage, which was basically to get the information they already had and show it in a better way, which, okay, it's done. We achieved that. The second stage is to what we call a book, which will help us show not only information on health providers, but a much broader like data set of information on health in general in Uruguay, like epidemiologic information, vaccines, prevalency of different illnesses. We have a ton of information we already want to show, and that's the second stage, which we are already starting right now. And then the third stage, which we should have ready for next February, is exactly that: have feedback on users, not only on if the information is true or false. We already had a lot of that coming back from the feedback. We are using user voice, which is a feedback mechanism, and we have got a lot of that, and that went straight to the ministry, and they already had a very interesting talks with some health providers about the information they published and what actually happened. But we're installing a proper feedback mechanism that has to do not only with if the information is true, but also with complaints and requests for health providers from their affiliates. But that's coming on February.
And is there a thing of changing health providers as well? Have you got statistics on this is how many people changed from this health provider and this is how many people went to this other health provider?
Well, that information is published. We don't show it over here in part because our focus is not on people changing or not, but on having the right information. I mean, they can do whatever they want. what we care about is showing them the right information. But if you want it, I can send you they have an annual report on how many people change, which basically the system is very stable. Usually people go from one provider to the other, but the general results always stay more or less the same. Around 64,000 people changed providers last year, and that was what happened, was very stable.
Yeah, and coming back, like, what did it take you to persuade, or like, how did you work to create this coalition and to work together with Department of Health in Uruguay?
Well, the whole thing started because they were already publishing the data. They just were publishing it in a very unfriendly way, but with the best intentions in mind, I guess. So what we thought at that point, that was 2014, start of 2014, we were working, we had an agreement with an online portal to do some data journalism stuff. So we took that data and we did this previous version of the app, which was called Transfer Season, making a joke between what people could do in February and the transfer season in football. And the ministry liked that. They very much liked that somebody was using that data and helping them get more people to see that data. So after that, we had some discussion tables in Uruguay around the OGP process, the Open Government Partnership process. And that was an opportunity for us to meet with the health ministry and to talk with them. That's when we started thinking about doing something together. And by November 2014, we had an agreement signed and we started working on this project. And right now, actually, we're trying to get to renew the agreement to keep working all the way to 2020.
That's a great plan.
And you said it was going to be, you're trying to set up a collaborative process again, right?
Sorry?
So you said that you're looking for this process to be very collaborative again, or like a joint venture?
Oh, yes. Yes, definitely. That's one of the interesting parts, is that from the very beginning, we were really working together with the ministry. I mean, it's not that we came up with this idea and sold it to them in any sense, or that they already had a previous idea on their mind and asked us to do it. From the very beginning, we sat and we thought, okay, what should we do? What should we improve from what we have done? Actually, we changed completely the way we showed the data from the previous app, and that had a lot to do with them actually explaining us the way that data should be shown, because we were doing some stuff that was probably not the best way of treating or showing that data. And also, we both invested money in this. The ministry has invested $12,000, and we got from Avina, which is a foundation, another $13,000. So this is, in that sense, is completely co-created. It's not even owned more from by one of us. It's also hosted in our servers, so they don't have actual final control on what's published. It's really based on trust, and luckily we have been able to not only keep their trust after we published it, but to keep working on and advancing in that sense.
It's very inspirational for us. So building trust between civil society side and the government representatives. I think it's the missing part here on which we should work on.
Is there interest by the Department of Health to publish more data given the success of this venture?
Sorry, I didn't get the full question. Interest on the Department of Health for?
To publish more data in this way. Not just
oh, yes.
but anything else.
Yes, definitely. I mean, actually, what they've been doing is they've been publishing data for the last 4 years, and every year they add some new data. So that's on them. That has nothing to do with us. That's something they already been doing. What we insisted was on that data being published properly as open data, and definitely the plan is to keep adding more data. But the thing is, we don't have the advantage of very mature data management skills within the ministry. The Uruguay has come from the last 10 years were pretty good for us, but before that we had a very long period of not very good times. So the public sector really feels that. I mean, they're working with very outdated technology in many places, and they're working hard to update that, but it's still hard work. So we don't have the ease to just know that all data is properly managed, is there, and it's only about publishing or not publishing. Beyond the political decision to actually publish data, sometimes we have the problem to actually gather the data or know who has it or if it's comparable and stuff like that. So it's, in that sense, we're working in parallel, both within the ministry, they're working to update their systems, upgrade their management and their skills within the ministry, and also to, as that work progresses, to share it with everybody and publish data and stuff like that.
And what's the uptake on use? How many users have used the data? You know,
well, that's a good question. We had 34,000 users for the app. That was basically in February, because as I was telling you, that's the period where people are interested in this data. And to put that into context, Uruguay has 3.4 million people. The population is 3.5 million. So that's around 1% of the whole population. Around 1.5 million were able to change providers during February, because the condition is you have to be with your current provider for at least 3.5 years or something like that, or 3 years, I guess. So around 2% of the people who had the possibility to change health providers were the ones who used the app. And as I already told you, 64,000 people actually changed providers. So that's around 50% of the people who actually changed. Of course, we don't believe that every used the app was part of that group, but just to give you some numbers to compare it to.
Yeah. Anybody has questions?
I just have maybe one more question. So I know they publish this data so that the people can choose their health service provider. Does the government also use the data to look for improvements they can do in some of those areas?
Sorry, I can't hear you. Sorry.
Yeah. Is government using the information, the feedback which they get from patients to improve services which they provide?
Oh, yeah, good. Yes, I mean, we don't have still like the proper feedback system implemented, which that will be like the biggest step in that sense. But definitely we had very interesting consequences last year from the publishing of data by itself. As I was saying, the data was published on Excel sheets for the last 4 years, but the best number they got of downloads was 500. So the increase on exposure, if you want, was around 7,000%. So what happened practically was that nobody really cared about that information that was published before. I'm talking about the health providers, because nobody was seeing it. So they still were not sending some of the data. They were sending some data that was outdated or just plain wrong. This year, since the publication had a lot of impact on the press and everything, we started getting calls and emails and everything from the very first day from health providers that were worried that, oh, we just realized that data is outdated, sorry. And we really must correct that those prices are old and now prices are lower. And they were desperate, calling the ministry and calling us and correcting stuff that they really couldn't care less for the last 4 years. That was a lot of fun. We even had one of the providers, they send much of the data, they send it to the ministry through sworn declarations, which is something you had to get a lawyer involved and a notary, stuff like that. And usually it takes them like a month to do that. One of them got a brand new sworn declaration in 2 days or 1 day, something like that, because they were so desperate to update their prices. So, and actually the funniest part is, even though they send it, the ministry decided not to update it on the app just to make them angry. So yeah, that was that was mean but fun. So yeah, there was a lot of consequences on the data just getting published. The political system actually started a discussion on the quality of healthcare for the first time based on data and not based on opinion. We had politicians talking about the app. We had the unions, especially the doctors' union, talking about the app. The healthcare providers themselves. So yeah, a lot of impact on that sense.
And there's a legal obligation on the part of the service providers, the health service providers, to give the data to the ministry, is there?
Yes, but with a little caveat. It's an obligation for, let's say, a group which is part of the system where you get some money discounted from your salary and that pays for your healthcare. For the private insurance, which is not exactly the same of what you call private insurance, but it's the closest thing, they are not forced to give their information. Actually, I'll show the screen again and I'll show you specifically this. There, I want. If you see, for instance, where are they? Here. See, most of these ones, which have seguro privado written, which means private insurance, some data they don't have. Like there, right? That is basically because since they are not the ones who have to send the data, they usually don't. Some data they do have to send, like for instance, waiting times. But what we are hoping that happens this year is that since we started publishing this data and now people are comparing this, they will be very interested in showing this. And basically, because they have very good numbers in that sense. So they didn't care before, but we hope that in that sense, greater transparency of the system as a whole will end up forcing them, if not by law, by just practical reasons, to publish the data.
Excellent. Great. Look, thank you very much for your time and for this presentation. We're going to show this video to our own health providers again and again.
Thank you very much for the invitation. It was a real pleasure. And whatever I can help with, just let me know, let us know. We at Data Uruguay love to work with people around the world. It's also a lot of fun. So whatever you need.
Awesome. Thank you very much. Thank you, Daniel. I'll stop
Thank you.
broadcasting. Yeah. Bye-bye.
Okay. Bye-bye.